Imagine stressing and worrying over the most basic social interactions, such as saying hello to your neighbor or talking to someone on a cell phone. The distress from social interactions and the anxiety they create is social anxiety disorder. Someone with social anxiety disorder gets extreme anxiety from social situations. It is a perception or knowledge that they will encounter a social situation that creates anxiety. The person associates fear to social situations he or she is unfamiliar with. For example, a person with SAD would find attending social gatherings very distressing if they don't do them often. Even the thought of attending would create anxiety. This anxiety would build up weeks before the event actually takes place. This is a list of the effects of anxiety. People with SAD have an extreme and irrational fear of being judged, teased, and humiliated by others. This fear causes anxiety for every social situation because of uncertainty. It is a disorder since the person cannot talk themselves out of it and eliminate the subjective fear that has no logical attribution. The person afflicted is capable of performing the social interactions but with great effort and suffers from the anxiety they create. They miss out on opportunities because of the disorder, severely limiting them in their social life, occupation, and everyday activities. It causes distress and impairs a person's life. Most people do not have SAD or will not get it during their lifetime. Those who do normally show symptoms at the age of 13. According to Statistics Canada, 8% of the Canadian population reported to have symptoms of SAD sometime in their life. This illness is very uncommon in Canada, therefore deviant. The following flowchart gives a compressed cause and effect relationship on SAD. There are 3 vulnerabilities for developing social anxiety disorder, like other anxiety disorders. There should exist a biological vulnerability in the person that predisposes them to develop SAD, like a genetic factor coming from a relative that is sensitive to anxiety of a certain thing, or an overactive amygdala. Difficulties during birth or traumatic experience very early in life also trigger a vulnerability. The second one is a psychological vulnerability that a person will have to be diagnosed with SAD. This includes his or her attribution style to scrutiny or ridicule and the levels of his or her personality on the Big 5 factor model. For example, high neuroticism or low extroversion could be vulnerabilities. Personal beliefs of people and the world and cognitive appraisals could also be vulnerabilities. The last is a specific vulnerability that channels your anxiety to a certain aspect. For SAD, this vulnerability can be environmental. For instance, your family household wasn't very sociable. Teasing could have occurred and combined with low social skills to lead to a vulnerability. Real life scenario. A college student withdraws from a course when he hears that he has to present in front of a class for 10 minutes at the end of the course. Sadly, by dropping the course, he loses the opportunity of being in a team, making friends, sharpening his social skills, and loses time that could be spent on another course. Performance in school and performance in work drop because of SAD. Real life scenario. A teenager with SAD may skip classes and avoid extracurricular activities, both dampening his or her success on his or her education. A shift supervisor may decline a department manager position because of the anxiety this job would create from working with a lot more people. This has been an educational video clip on social anxiety disorder brought to you by the Psychology Department of Kwantlen Polytechnic University.